Tina, also known as the Purple Vet, and I decided to create this vlog to show you guys a bit more what integrative medicine might look like. So in this vlog series, I'm going to follow a very famous integrative vet, Dr. Marlene Siegel. She is doing research. She has over 40 years of clinical experience. She's been doing integrative medicine for the last 20 years. She's writing papers, she's an author, she's a public speaker. And yes, I'm very excited to share with you what she has been showing me the last week. So in today's vlog, she's going to show us a bit of what her hospital looks like and what cool tools and equipments she uses in her daily integrative practice.
We're seeing more disease, obviously more cancer. When I started practicing, I actually found statistics that showed back in 1985, there were studies that showed less than 1% of dogs that were presented to a veterinarian had cancer. And of those dogs, they were over 10 years old. Cats were 0.5%. In today's world now, since 1985 to 2026, we are now seeing over 1 out of 1.65 dogs getting cancer. That's almost 100%. The cat cancer rate is just as high, and the level of chronic disease is almost 100% of the pets that we see age irrelevant. So we're seeing this in animals that are under a year of age. And in my practice, I'm going to test these animals, and I find that have massive amounts of mycotoxins, microplastics, glyphosate. In other words, there's many root causes to their problems that are being ignored because in standard medicine, we're doing symptom suppression. We're not looking for the root cause of the problem. We need to find the root cause of the problem and fix that, and the problems go away. Hi everybody, welcome to Pasco Veterinary Medical Center. I'm Dr. Marlene Siegel, and I'm really excited to share with you what we do in our hospital. So come with me. The first thing that I want to do is help you to have an expectation when you see an integrated veterinarian. So a lot of people don't really understand what that means. An integrated veterinarian uses the best of the Western practices, blending it with the best of the Eastern practices to provide the best health care for our patients. And our goal is actually to find the root cause of the problem. Well, in order to find the root cause of the problem, you have to have a good history, you have to do a thorough physical exam, and you have to be able to have a large enough toolkit of diagnostics to be able to find what the deficiencies, the toxicities, and the mitochondrial deficiencies are. So let's talk about what a good history actually means. It's being able to take the information in a chronological order and be able to see what's been going on in that pet's life from the point where you first acquired that pet, if you have that background history, or if it's a stray and you don't have that, then you're going to start from where you're at. But we should understand what that pet's environment is, what the diet is, everything that they're actually eating, what kind of water they're drinking, where is it coming from, and what's the air quality in the house, what are the cleaning products that you use in the house. These are all really important pieces of information that help us to understand what the exposures are to toxicities. And then of course, when we evaluate the diet, we're looking to see how close is it to a species appropriate diet. Well, sadly, in today's world, all of the foods that we're eating is pretty much nutrient depleted, because if it's grown on soil that doesn't have all the right nutrients, not done with regenerative farming, then whatever grew on that, whatever that soil is going to be depleted, and whoever ate those grasses are going to be depleted, and then whoever eats that meat is going to be depleted. So it snowballs along the way. So what should you expect from your veterinarian regarding the physical exam for your pet? Well, I call it from the tutor to the snooter. We want to look at everything on that animal. We look in the ears, we look in the eyes, we look in the mouth, we check the teeth. We're looking for lymph nodes, we're checking the skin to make sure there aren't any hair loss or scabs or lumps or bumps. And then we palpate the abdomen. Of course, we listen to the heart and we listen to the lungs using a stethoscope. But we're really thoroughly looking at every aspect of this animal that we can touch or feel. Getting a temperature, a pulse, respiration, and of course monitoring weight are all very, very important. One of the most important things that I do in my practice, and one of the reasons I'm so successful, is because I test, I don't guess, which means I'm doing the proper laboratory testing to identify specifically what are the deficiencies and toxicities that my patient has. And sometimes pet parents will come to me and go, oh, it's so expensive and I don't want to spend the money, and they probably have it anyway. Why are we bother testing? Well, we're testing because one, we need to know what levels we're at. And two, we want to be able to measure against our therapeutics to make sure that whatever we're doing is actually working. So it really is important. And if you don't allow your veterinarian to do the proper diagnostic testing, you're kind of throwing spaghetti on the wall and you're seeing what sticks. You really don't know what you're dealing with. Welcome to the laboratory. We do a lot of our diagnostics in here, but a lot of the diagnostics we do, we actually send out. So when we test microplastics and we're checking for heavy metals and glyphosate and nutrient deficiencies, all that goes out to an outside lab. Bioenergetic scanning is a really interesting way of being able to look at the body in a non-linear form. So we know that we are energy, and there were people who developed this technology that recognize that there's certain energetic signatures that represent, let's say, conditions. And so this scanner will go through all of the meridians and all of the body systems and look for imbalances. So the body, when it's in perfect condition, is in homeostasis. But when we lose that homeostasis, that's when we start to see imbalances and we start to see symptoms. So the scan is looking for those imbalances or those areas where there is a lack of homeostasis. But what's really interesting about the scan is that it prioritizes what is the most important thing that the body needs to fix in that moment. And sometimes it doesn't have the same name of the condition that you're thinking about, but it's all the supporting things that are happening underneath that are creating that condition that is now not in homeostasis. So just running the scan actually creates a feedback mechanism that actually helps to improve the body just by doing the scan. And then we can make imprints, which are the energetic signatures that the machine is telling us that the body needs in order to start getting back to homeostasis. So one of the things I love doing is what I call live blood analysis, and I do light field microscopy, not dark field. And what I'm really looking for is the morphology of the red blood cells and the fourth phase of water, how it's interacting with the cells. So the fourth phase of water is the structured water that's supposed to be in our bodies. But when we're exposed to toxins or a lot of stress or a lot of electromagnetic pollution, that fourth phase of water actually collapses down and we lose the ionic charge that separates our red blood cells. So what happens is they start to stick to each other, and it's a condition that we were taught in school is rouleau. Well, interestingly enough, we were taught that rouleau is normal in horses and cats. And I promise you it is not, because I can make it go away in every single case with a variety of different therapies that we do. So the more that we see the rouleau, and sometimes even worse than rouleau is aggregation, where the cells just come together like clumps. And when that happens, the cells can't do their metabolic function. So a red blood cell is supposed to use the surface area to pick up oxygen, deliver that to the tissue, and then pick up waste material and deliver that out the body. But when all the cells are compressed against each other, you're covering a lot of the surface area. Think about a tennis ball. If you had a bucket of water and you start adding tennis balls, the first tennis ball that goes in is touching the water all the way around. But then as you start adding more tennis balls and it gets crowded, then they start to compress against each other. And by the time you've added as many tennis balls as you can possibly add, then there's very little surface area actually touching the water. Well, that's what's happening to our red blood cells. The more that fourth phase of water collapses, the more these cells are sticking to each other and covering the surface area, creating this more toxic situation where they can't get oxygen and they can't get waste products out. So we find that a turning point for most of our patients is that when we can separate that rouleau, they start to make an incredible change in their metabolic activity, and we start to see them actually start to heal. So for me, diagnostics are about collecting as much information as possible so that I can uncover what the puzzle is. We all remember the game Concentration, and you turn over a tile and you're trying to figure out what the message is underneath, and the more tiles you turn over, the more obvious the message becomes. Well, I think that's how doing proper diagnostic testing is. The more information that we can get about a particular individual, the easier it is to understand what is happening from a metabolic perspective. What is imbalance? What is going wrong? Why is it going wrong? And we can really get to the root cause of the problem, because if we don't get to the root cause of the problem, everything else is symptomatic management. Health hygiene is so important, especially for our environment. So we make our own cleaning supplies. We don't want to use things that have a lot of chemicals that we can't pronounce the names. So here we have our lemon and lime rinds that are in an alcohol base, a vodka base. And then we have our vinegars over here. And then we add essential oils to our completed products, depending on what we want to use, because our essential oils are antiviral, antibacterial, and antifungal. So now what I want to talk to you guys about is environmental hygiene and health. And so one of the first things that we work on is air quality. This is Jasper. These are on our website, and we can get you a nice discount if you're interested in learning more. But this is our air scrubber. The benefit of this particular machine is not only does it clean down to 1 micron, but it moves a large volume of air. So if you had a scrubber and it only did its immediate area, that doesn't do you a lot of good. We want to be able to move enough tidal volume of air, cubic feet of air, to be able to actually clean that room. I am so passionate about water that I have this system at home, and I also have it in my office. And that's so we're giving molecular hydrogen water that is filtered and structured to our patients, to our boarders, and of course to our staff, because we want to walk our talk and we want to do that for our own bodies as well. Another passion of mine is being able to mitigate electromagnetic pollution, because we are in a hospital and we do have Wi-Fi and we do have a lot of electronic equipment. So we use what is called a tower. And so this is our tower, and it is stainless steel plates that are impregnated with something called plasmonics. And when light reflects off of the stainless steel plate, it comes back out through that plasmonic membrane, and it changes the light frequencies from incoherent to coherent, so it interacts more naturally with our bodies. The box itself is important because there's a scalar chip in the bottom of the box. So that is now enhancing the beams that are coming off, the light frequencies that are coming off of that plate, and spreading it out much farther and in multiple directions. If we want to use this plate therapeutically, we can take it out and actually aim it right at the patient and affect the 4th phase of water and affect literally how light is interacting with that pet's body. We talk about the principles of entrainment, you know, where you're around people, girls that are all living together in a dorm and they start to have their periods together, or you're tuning a piano. But what does really entrainment look like? It means that when one energy collides with another energy, over time they start to share energy until they're all in sync. So that was under a minute, and now they are all moving with the same energy. So they've entrained their energy in sync with each other. Now, if we didn't have the friction of air, they would continue moving infinitely. But because there's air friction, it's going to eventually slow it down. But it's just remarkable, and this is a physics principle called entrainment, how energies quickly share up. This is why you want to make sure that you're around really high energy, good people that are aligned with your same belief systems and value systems, because you entrain energy with each other. So the reason this is so important to me as a veterinarian is because our pets entrain to our energy. So if you are in a lot of stress and anxiety and anger and fear, your animals are picking up those feelings, not exactly how you interpret them, but they're sharing the same energetic feeling, and they become very sensitized, high sympathetic tone. And then when they go to heal, they can't, because they can't get into a parasympathetic state. But the more you, as a pet parent, learns to be relaxed, deep breathing, meditation, whatever it takes for you to get parasympathetic, your pets will entrain to that as well. So in all of our therapies, we always start by getting our patients in a parasympathetic state, a state of relaxation, which is the only state that the body can actually heal. And so this machine is called a magnosphere, and it produces these torus fields that go in all kinds of different directions, and the center of it right in here is the strongest field. So we put the patients in here and we can dial in frequencies that are all parasympathetic or all sympathetic, or combinations depending on what we're actually trying to achieve. and then you're just laying in here and enjoying relaxation while these beams are actually going through you. It's all done in pulse electromagnetic frequencies, but what makes this unit special from 99% of the other ones on the market is that it's in picotesla, very, very low frequency that matches the frequency of our tissue. So just imagine if you were tuning in a radio and you were just a little off the station and you just had to tweak it to get back on the station. That's what this machine does. It tweaks us back to normal. All right, guys, I'm on our Sonics machine, and this is a vibration plate, which we can change the level of vibration for lymphatics or for a variety of other things that we need the body to do. And it also has frequencies involved. It's like a Rife machine. So we combine the vibration with the Rife frequencies, and we can achieve all kinds of healing from the mitochondria. You can hear my voice now because it's getting a little stronger. It's an amazing machine, and it's really fun to be on. So this machine is called a TheraAir, and it basically takes water, structures the water into that fourth phase water, and then when you breathe it in, it's structuring the water in your body, because that's when your cells are able to actually get their correct charge and separate is when they can do their best metabolic function. For the pets, we just hold the tubes near them, and that way they're getting, but when we have this actually going in the room, it's actually structuring the air in the room, so you're just breathing it as part of your therapy. Hi, this is our infrared sauna. We use this for the pets, and usually we either go in there with them or we'll watch them through the window, but this is all part of infrared therapy for detoxification. This is our ion foot bath. So when we have a patient, we'll fill it with water. We put in salt, which creates the charge, and this is a little machine that does the electrolysis in the water, and then we take the animal and put either their front or their back feet in the water, and then they do a therapy, usually about 30 minutes. And when you take them out, we look at the colors in the water, and that helps us to understand what they're detoxing. So we use this for detoxing heavy metals and toxins. So they say the colors are indicative of some of the toxins that are coming out and what organ it's being released. Whether that's true or not, I don't know. Because if I didn't have anything but the salt and the mechanism to be able to create the charge, there still would be a color change, but it wouldn't be as dramatic as this. So we can see that there's a lot of toxins that build up in the body over time. We've got hormones, pesticides, chemicals, heavy metals, mycotoxins. There's so many different toxins that we're exposed to, and they're just gunking up the body so it can't function properly. So when we do our lymphatic therapy and we get everything starting to flow, and then we put them into the ion foot bath, we're taking a lot of that chemical gunk that's circulating and we're helping to pull it out through the feet. You guys have to follow me in here. This is our Himalayan salt room, and we literally have a salt room. So as we enter into the Himalayas, what happens is we put our patients into the salt room. They close the door, and there's a halo generator on the outside, and the salt becomes aerosolized while you're sitting inside, and you're breathing in the salt, and it's going all over your skin and your eyes, and it's acting like a scrub brush down your lungs. So it's like taking and cleaning all of the ciliary membranes. And salt is wonderful because it's antibacterial, antiviral, antifungal, and it's all natural. This is our Weber laser. It was invented by Dr. Michael Weber, who is a practicing MD in Germany. And its claim to fame is that we can deliver light frequency into the body, actually intravenously, right through an IV catheter. We are light beings, and we function with light. This machine produces ultraviolet, blue, yellow, green, red, and infrared lights. And each one of those wavelengths has a different specific action on the body, including affecting mitochondria, including the enzyme, the normal enzyme activity within our cells. So we are able to enhance how the body responds in a very natural way without negative side effects. We can deliver the light intravenously or intralesional. So if we had a tumor, we can put needles into the tumor and then add the fiber optics and actually light up that tumor. When we give a photoactivator, these are natural compounds that go into the tissue, and then we use the proper wavelength of light to activate that compound and make it more enzymatically active. And therefore it's more effective. But it's very targeted for the tissue it's activating, and it doesn't have the negative and collateral side effects of things like chemotherapy and radiation. This is our ozone station, and we can either produce ozone gas directly from the machine, and then we can mix that with blood or inject it into tumors or wherever we need the ozone gas. And we can also bubble it into fluids. So if we want to rinse something with ozonated saline, we bubble it through the water, and then we can apply that as needed. This is called a machine that does ultraviolet blood irradiation. Very similar to our Weber laser, where if we want to use ultraviolet light in our Weber laser, we can go right into the vein and deliver that. If somebody wasn't going to do that, they could deliver the ultraviolet this way. So we draw blood, we put it in a special cuvette, and that goes inside the machine. And then when we turn it on, the blood is sitting up here. We close the lid, and the ultraviolet then the blood circulates, and the ultraviolet light is activating all the red blood cells, picking up that frequency, and then once it's saturated, we put that back into the animal's body. So this is another one of our lasers. This is a class 1 laser, and what I really want people to understand is that the class of the laser has nothing to do with how good it works or the intensity. It has to do with the safety of the laser. So a class 1 laser, you don't have to wear goggles, where a class 4 laser you do. We use our laser for a lot of different things. We use it to stimulate nitric oxide release from the bloodstream, from the cell wall, so that we can get better blood circulation. We do it to improve tissue healing and collagen formation. We also have settings that help with lymphatic movement and swelling, to bring swelling down. And we have a setting that actually stops pain. It doesn't do it forever, but it gives you, in a moment of an acute injury, we can hit it with a frequency of 5,000 hertz and be able to minimize the amount of pain that that individual is in that moment. Welcome to the hyperbaric chamber area of our hospital. So this is our small hyperbaric chamber, which is a little more challenging to get in. We have to kind of go and crawl in through here. So it's a little harder to get in. And then this one is the one that we just absolutely love. This is called the end cap, and the whole end cap opens. So we can just literally crawl right in and get all the doggies to come with us. Come on, Sky. Yeah, come on all the way in. Here we go. Come on, Adi. Come on, girls. This just gives you a good appreciation of how big. Come on. Come on. Like, we haven't even filled up half of the unit yet, and you got all this spaciousness. So the beauty of hyperbaric oxygen is that you're under a little bit of atmospheric pressure, which helps to take oxygen and push it further out into the tissues. Most of us are oxygen deprived, and by increasing a little bit of the pressure, it's helping to push that oxygen all the way out into our tissues. Before we put our patients into the hyperbaric chamber, we give them an ozone therapy so that we're increasing their oxygen content, and then we use the hyperbaric machine to help push that into the tissues, because bad things don't like to grow in oxygen-rich environments. This is our oxygen generator, and we use this to increase the amount of oxygen in the ambient air when our patients are in the hyperbaric chamber. So it just enhances the therapy. This is our XP2 machine. We use it for lymphatic therapy in our office. So these glass probes, along with how we create our settings, create a microcurrent, inert gases, and as we're hovering these probes over specific locations, we can open the drainage points for lymphatic drainage, and then we can decongest areas and then sweep them into the appropriate lymphatic drainage port. Because we can adjust the settings, we can do a more superficial drainage, especially in the beginning if these animals aren't used to that. And then as they get more used to it, we can do a deeper setting and go all the way down into the abdominal organs. The lymphatic system, in my opinion, is one of the most important detoxification systems in the body. I think the lymphatic and the liver do the most work in the body. So it's really imperative that the lymphatics are able to function properly. In the olden days, when we had a lot of movement and a lot of high intensity activity, we were pumping those lymphatics because they don't have their own pump. It's not like the heart, where the heart is helping to pump the blood. The lymphatics work by contraction of muscles that help to move it along. So they have to have a healthy fascia, and then they have to have good muscle contraction. So for a lot of the animals that we're dealing with, they have a lot of lymphatic stagnation, which leads to a lot of health challenges, including cancer. And then when we do surgery or they have injuries, we may end up interrupting the lymphatic area, and this helps to restore it. The chiropractic adjustment, we use an activator gun, which is called a dual tool. And I have it at a particular setting that's going to be comfortable. Never done this on her before. So we're going to see how she responds. Not too bad. What I like about this over a manual adjustment is that it's very consistent and not uncomfortable to her, not trying to crack anything. And so I liken this to when you have a circuit breaker that pops and there's no power going out to that particular box. So if this circuit breaker popped and I tried to use it, you wouldn't get any power there, but there's power to the whole entire building. So when we do this chiropractic adjustment, it's like we're taking and turning the switch off and resetting it and turning it back on. We're reactivating it so that the body starts to now integrate the energy and the information that we're trying to send out from the spinal cord. Now what I'm doing after I reset the spine with the activator is I'm using this, which does myofascial release. So it's helping to stimulate the nerves and send the energy that I just reawakened out into the body. This is one of the fascia releases that we do. It's called the grip and grab. And I'm just testing right now to find out what kind of tension she has in her skin. And here she's a lot tighter. So here you'll watch, I can pick it up so much easier and move it. But when I get here, which is where her arthritis is, this is where it's stuck. So you can actually appreciate that there's more fascial restriction right in this area. So we're going to teach the owner how to do the various different releases so she can be doing them at home. And even just as I'm holding it, you can see it's releasing. I'm getting higher and higher. I have a couple different methods I use for doing cold therapy or cryotherapy. So we have a cold plunge machine, which helps us to induce a hormetic stressor, which is something that is biologically important to our bodies and our pets' bodies to be able to induce that kind of a stress because it helps us to become more resilient. The other way that we can do cold therapy is using a cryo machine where we can do focused cold. And so we'll do this along the spine or along an area that has pain. So it helps to reduce pain and inflammation, improve circulation. It's very comfortable treatment. It's not expensive, easy to administer, and it's very well received by the patients. My goal for doing therapies, particularly intravenous therapies complemented with oral therapies, is to actually enhance the biology of the body. In traditional allopathic medicine, many of the therapies are aimed towards symptom suppression. We want to kill things, we want to destroy mechanisms, we want to kill the cancer, but we're also inadvertently affecting the body's immune system at the same time in a negative way. So what I think works very well in my hands is we do things that are in sync with what the normal biology is. So when we give intravenous therapies, we're doing things that complement what the body's immune system would naturally do, using antioxidants, using pro-oxidation, being able to stimulate the pathways that are already present in the body and getting them to be working better. And then we support that with the oral supplementation that we use, particularly starting with the foundational things like the essential vitamins, minerals, fatty acids, and amino acids. But we live in a world where our food is nutrient depleted for ourselves and for our pets. So in order for our bodies to work effectively, these nutrients are not just part of a multivitamin. They are actually the core essentials that are necessary to run our biological processes. They're the cofactors that make these biological pathways actually work. We don't guess, we test what the body actually needs. So I think combining diagnostic testing, proper diagnostic testing for deficiencies and toxicities, combining that with supplying the essential nutrients, and then enhancing the particular biochemical pathways that are necessary for that patient's individual problem. Is it kidney failure? Is it cancer? Is it liver disease? Of course, there's going to be some similarities and overlap, but we're also very much targeting the support for that particular process that the body needs to do its job. And we're not trying to do symptom suppression, we're actually fixing the root cause of the problem so the body has the intelligence to actually repair itself. So many of my clients come in and they literally have a box of supplements, and they all do something wonderful, but it's more like they're just taking and throwing spaghetti on the wall and seeing what sticks, because they heard that this product does that particular benefit, and then there's another product that has good effects on something else. But one, we don't even know if that product is actually of biological value. What's the quality of the product? How was it manufactured? Is it in sufficient quantity to actually do what we're thinking it's going to do? The nutraceutical industry is the Wild West. A lot of people get frustrated with their veterinarian because they feel like it's always the same thing: an antibiotic, a steroid, a chemo, a radiation, a surgical procedure, and then they get to the point where they don't have anything else to offer except euthanasia. And it's not the veterinarian's fault. Veterinarians are the most wonderful people in the world, and they have the biggest heart, and they want to do the right thing. But if you have a very limited toolkit, then you're limited to the things that you can do. You certainly wouldn't want to go to a surgeon who does all of their surgeries with 3 instruments, right? They don't have enough diversity to handle the complexity of different surgeries, that they would need different pieces of equipment that would make it a safer and more efficacious surgery. And the same thing applies to our internal medicine and our detoxification and all the other things that we do. We need a big enough toolkit so that when a problem arises, we can offer a solution. And I think that's the only difference between what I do and what most of my colleagues do, is that I was very committed to never telling somebody there is nothing more that can be done. As a consequence, I have this entire toolkit that is extremely diversified, very expansive, and it allows me to do so much more that literally for the past 30 years, I have never had to say to a client, there's nothing more that I can do. I always find something that will improve quality of life, because that's my first objective no matter what. And in my best world, it's also improving longevity. We're not going to live forever, none of us are. But can we live our best life with the health and happiness and quality of life for the time that we're on this planet? Absolutely.
Happy birthday, dear Marlene. Happy birthday to you.
I thought I missed my birthday. I am a solid 69. And I look forward to many, many more years of vibrance and health, and being able to help the world and be a model for the things that I do. I walk my talk and I live my life. I am so passionate about what I do, and I know that veterinarians all want to do better. They all want to do the right thing, and they all want to learn. But if you're living in a paradigm shift where you're stuck with what you're taught, then you don't realize that there's a whole nother world out there. And it's not a new world, interestingly enough. A lot of the things I do are old, ancient therapies that have been around for thousands of years, and we're just incorporating them in a modern setting. But I encourage any veterinarian who is interested in expanding their toolkit. If you're the person who doesn't want to say to somebody there's nothing more that can be done except euthanasia, if you really want to be able to learn what else you can do, and trust me guys, there's a ton you can do, then feel free to reach out. I have an online training program. The basic program is almost 38 hours, so it's very, very in-depth. And then I have other courses that go into specific modalities like fascia decompression and lymphatic therapy and many, many other things that we teach, the specialties, ozone therapy, hyperbaric oxygen, so many of the other things that we do for detoxification and for cancer therapies. And I love teaching. I'm not going to be here forever, and I want to pass on a legacy to my industry so that we as a community of veterinarians can do better. I'm finding so many pet parents that are looking for information and guidance. And the internet is flooded with information. It's almost egregious how much information is out there. But there's two problems. One, you don't know if it's good information. And two, there's so much. How do you cut through all the noise and figure out what's the right thing for you and your fur baby? So I've created an online program. It's kind of a self-study. It's a 3-hour, almost 3.5-hour online tutorial. It is what I use as my consultation before clients come to me, but it's a plethora of information. And I think that's a really good starting point because it teaches you, the pet parent, about diet, digestion, gut health. It teaches you what testing would be important to do to understand what the deficiencies and toxicities are. It teaches you in depth about detoxification and how you can support your pet's organs of detoxification. We talk about mitochondrial health and why that is so important and things that you can do to support that. And then last but not least, we talk about the emotional connection and how trapped emotions play a role in our pet's health journey and ours. If that's what you're looking for, then our Empowered Pet Parent course is the program that you can start with. And if you have a veterinarian where you live that you really love and you've been with them a long time and you think they're wonderful, but they just don't have the same toolkit that I'm teaching you about, then feel free to encourage them to either take the program that I have for veterinarians or to consider expanding their toolkit, because we want to get everybody on board. We want people to be able to do better medicine. This isn't the type of world that our parents grew up with, right? These animals are a lot sicker and there's more complex diseases, and we all just have to shift with the times. And this would be a way for you to encourage your veterinarian who you have respect for to consider expanding their toolkit, learning a little bit more, and joining you on the health journey for you and your fur baby.